you very much, Tony, and thanks very much for the opportunity to speak here. And I've been to, I think, probably every Anaphylaxis Campaign corporate conference, and I would absolutely agree with Peter. This is by far the best one, so great job. Okay, so I wanted to talk about what does free from really mean from several different perspectives, because for me, it depends on who you are as to what free from really means. So from a regulatory perspective, it's really very simple. It's an absolute claim unless there is a regulatory threshold. Very simple. From a consumer, it's an absolute claim. It doesn't matter from a consumer's point of view if they are having to buy free from for a medical reason or they have chosen to for a lifestyle. They assume free from means zero. From retailers' perspective, different retailers will have different rules. As somebody said earlier, they have different codes of practices. Manufacturers have got to try and guarantee that claim every single time a product leaves their door. Catering, in my experience again, some will equate does not contain to mean free from. And as I go through my presentation, I want to try and break it down into these 5 different groups as to what free from actually means in practice. When we think about how much is not, what do we mean by that? So, from a regulatory level, let's think about recall levels. Now, for gluten, we have a limit of no more than 20 parts per million. That would appear a clear claim, wouldn't it? A clear choice. But you have to take into the testing analytical uncertainty. And with something like ELISA, you're looking up to 15 to 30%. So 20 starts to become perhaps not such a definite number. But for something like milk, there is no regulatory limit. So that's much less clear about how much would be too much. To a consumer, any level above zero is unacceptable. But how do you measure zero? You can't. So that's starting to become quite difficult. From a retailer perspective, they may set acceptable levels, but is that based on a particular type of method or a particular type of test or even a particular testing kit? And we've heard a little bit today about some of those variabilities. For manufacturers, they have to substantiate it every time. So how much testing should they be doing? And I think, in my experience, I spend most of my time actually in factories helping manufacturers do this thing called allergen management. And increasingly, we do more and more work now with people trying to manufacture free from. And they struggle with this. Well, how much do I have to do to substantiate that free from claim? Catering are unlikely to do any testing, so they're reliant on other types of controls. So this how much is not free from starts to be really quite a difficult question to answer. So let's start and just briefly think about regulation. I'm aware I've got FSA in the room here. So there are lots of different claims you see on packaging and in restaurants today, and this is just a selection really. And when you think about the different claims that are being made, it's little understood actually how many of these are covered by a regulation. I don't know how many people in this room would be aware actually of which ones are and are not covered by regulation, but it's actually a very short list. Gluten-free, yes. Suitable for celiacs as of July this year, yes. That's it. So everything else is not covered. There is no set regulation to cover those claims. So gluten-free is the only allergen for which we have specific legislation at the moment, and I'm not going to talk through all of that because it has just changed, in fact, in July 2016. But it does at least set a limit, as I say, if you're going to use that term gluten-free or now suitable for celiacs or suitable for people intolerant to gluten, you must have no more than 20 parts per million in the food as sold, not necessarily as consumed. So all other claims are covered by general food law. And I think Richard, obviously, in his presentation earlier, heightened that for me, actually, that actually lots of the potential breaches of regulation are not necessarily going to be about allergen labelling legislation. It's about the very simple principle of general food law that you must not supply food injurious to health. Lactose is a slightly different situation. There's no regulation that covers it, but it's the kind of the next level down of regulation, which is a directive that talks about a threshold for making a lactose-free claim in very specific types of food. And this is backed up by an opinion, which again is the next kind of level down, that says that a precise threshold just cannot be given. That's why probably there isn't a regulatory limit. So again, lots of people will think lactose free, you can put on anything and you've got a limit to work to, but actually that's not the case. Let's look a little bit now then from the consumer's perspective. So, consumers purchase free-from food for many, many different reasons. They may have a diagnosed allergy by a clinician or a diagnosed intolerance themselves. As I think we've heard a lot today, they might just be caring for somebody who has a diagnosed allergy or intolerance, and that can be a very much broader number of people. They maybe believe that they have an allergy or an intolerance, and that's why they're choosing to buy free from. They may have made a lifestyle choice, and that lifestyle choice can be based on lots and lots of different reasons, and it's a complex situation, certainly. Some people perceive free from to be a healthier choice, and that's why they're buying it. And I think the rise of that you see in the data these days is going up and up. But it doesn't really matter why those people are choosing to buy it. The standard under which it is either manufactured or through catering is delivered to the consumer has to be the same regardless. Let's look a little bit from the retailer's perspective. So the growth of the free-from market, we know, is going up and up. There's no question of that at all. Now, when you start to dig down a little bit more information, so a lot of those people who eat or buy free from today are likely to increase their consumption. And up to 33% of Brits in the previous 6 months to this had bought or eaten free from knowingly and actively. And actually a lot of them, or more of them, was because of a healthy lifestyle choice than because they had either an allergy or an intolerance. Interestingly, one of the other pieces of data was 54% said they would stop if they thought that free from was less healthy. And actually, one of the biggest barriers to buying free from actually is the price. We're talking a little bit today about how much more expensive the extra controls you have to put in place to manufacture free from are, and that, you don't get anything for free. So it's interesting that price is holding some of the people back. But there is definitely a drive for the retailers to gain market share. They know that the rise of free from is going up there, and they are competing with one another to take that market share. That then leads us on to the manufacturers who have to manufacture the food that's most likely sold through the retailers. Now, they are very much encouraged to supply free from as that market growth increases. Then it starts to get quite challenging in terms of what kind of environment are they working under. So, is the site fully dedicated? What does that actually mean? Fully dedicated means that the allergen that you are making the positive free from claim is not allowed anywhere on site. For me, I see lots of factories that are nut-free and peanut-free, but maybe are not making a nut-free claim. Very rarely do I go in a factory that's making gluten-free as a claim and actually have banned gluten everywhere. That's uncommon. Much more common is actually you might have the production site fully dedicated. So the free-from allergen is not allowed in production, but staff are allowed to bring it in to eat at their lunch times and breaks, and they're allowed it in the offices. Or the production site might be semi-dedicated, so an area where the free-from is manufactured might be zoned off in a physically separate area. That's quite common. Much, much more common, as the rise of free-from is growing, is the last one, where a production site is non-dedicated. There are shared lines, shared equipment, and that presents quite a big challenge to manufacturers. And the reason it presents a big challenge is all about the level of risk. If you have a fully dedicated site, that's the not allowed anywhere at all, the only risk you have then are your incoming raw materials. If your production is fully dedicated, so people are allowed to bring it in, then you have an additional risk of how you prevent staff from bringing that allergen into the production area. If it's a semi-dedicated site, then you've got a risk that you've got to manage the segregation controls that you have put in place to prevent allergen getting from where you want it to be to where you don't want it to be. If you're in a non-dedicated factory, you're at the highest level of risk because everything on that site presents a potential risk. What guidance is there out there? Well, the BRC and FDF published some excellent guidance at the back end of last year that was endorsed by CELAC UK and the Anaphylaxis Campaign to try and help both manufacturers and caterers on how to do this thing if they want to make free from, and it's an excellent piece of guidance. I'm not going to go through it in detail other than to set out to you that when the risk assessment for pre-packed foods was written, it broke the risk assessment down into these 5 particular areas. So when it talks about supplier quality assurance, that's a really big deal because that will impact everyone regardless of your level of dedication. Fact facility design is obviously important if you're going to zone an area, and production controls a huge area. A little bit on product testing and where it is and isn't appropriate, and not to forget about the distribution and transport practices. When you think about raw materials, if you're making a free-from claim, you need to ensure that all the materials you buy in are free from. That doesn't mean doesn't contain, it means actively free from. You'll need to ensure, how do you approve those suppliers in the very first time you're having a relationship with them, that they're going to supply you with material you're going to put into free from, and how do you then guarantee that that remains free from throughout the whole relationship you have with that supplier? It's a really important area, and I think it was probably Julia who said just keep asking more and more questions. This will start to help you to understand what that level of risk might be from that supplier, and actually introducing some kind of sampling program to maybe back up any audit findings you have is a good way to understand what that level of risk might be. Because you can't use these rapid tests to screen raw materials. They're only suitable for environmental swabs and rinse waters. You can't stick them in a bag of cumin to find out whether you've got almond in there or not. They just don't work like that, so it becomes quite challenging. This is an area in my experience that people are not very good at, the physical validation of controls. When you think about warehouse storage, people are obsessed with that we have to keep allergens over here and they can only go on that racking and they must all be labelled this way. When actually your main controls in a warehouse are about rejecting anything that's come in that's been damaged. If whilst moving it about you spill it, you assess the risk from that and you clear it up. You check that everything has got good, solid, intact packaging and it's clean and it's labelled and you know where it is. So how do you validate that? Well, if you have a system that's based upon location and labelling, you have to challenge both the system and the people. And the way you can do that is actually to give them the wrong thing and see what happens under controlled circumstances. Because if you say to someone, you need to go and collect this material and it's located there, and if they go there and that material isn't there, if your system does not stop them picking it, or their behaviour does not say, oh, I know it should be right, but it isn't right, then your control is not effective. And the only way to validate that is physically and then recording it. If you mispick an ingredient at the beginning, it is probable that you will never know that you've done that wrong, because the people who are then collecting materials ready for a recipe, so the staging area, may not know that something is wrong. You have to do the same kind of challenge to physically validate that system. If they have a sheet, a works order, whatever, where they're ticking off what materials they should be receiving, again, challenge them, give them the wrong thing and see what happens under controlled circumstances. Because again, you need to be sure that the system you have in place and the people are going to behave in the way you need them to demonstrate that that control is effective. Packaging. My favourite area in a factory. The worst thing you can do to an allergic consumer is to give them the right product in the wrong packet. The next worst thing you can do is to make the wrong thing in the first place by mispicking an ingredient. That's why I've picked up on these areas here. People even who have barcoding systems who say, oh, well, you know, it's scanning every single packet, I know it's right. How often do you actually challenge it, put the wrong thing down the line under controlled circumstances and check it does, flick it off? If it doesn't, your control isn't effective. So absolutely critical. And training isn't just about sitting someone down and getting them to answer some questions. It's actually about the culture and the behaviour. Have they been given the tools and the authority to say, actually, do you know what, I know you should have done your job right, but I don't think it's right. This is a really, really big area for manufacturers. Cleaning as a control, we've talked on a little bit about this today, and of course, if through risk assessment cleaning has been identified as a control measure, it must be validated. And in most food factories, cleaning will nearly always be a control measure. If you're going to have to verify that the cleaning is still effective, it has to be validated as well, and this is a really important area. But again, as Julia said, actually the most important thing is the monitoring of the cleaning. What you're validating is the cleaning method itself, so it has to be to standard written operating procedure, must be done the same way every time, must be inspected, ideally have some kind of independent sign-off. Choices of analysis. I said I'm not going to talk much about this today, and I'm really not, because I could be here all day. But if you're in a manufacturing site where you're making multiple products with multiple allergens on complicated multiple lines, you don't have to validate every allergen or every line if the process and the clean are similar. Cleaning validation is all about validating whether the cleaning is effective. So you can actually select a product that contains significant quantities of the allergenic ingredient as protein, test it as a positive control. What will that tell you? I've picked the right allergen and I've picked the right test. Then you need to select an allergen for which there is a reliable quantitative test, and that's going to be an ELISA test. But ensure that test has been fully validated. I'm often asked, oh, well, lab down the road there, they've got a lower limit of quantification for that test, therefore that test must be better. Not always. The limit of quantification is not an indicator of whether that is always going to be the best choice. It's all about whether the test and the method has been properly validated. You'd then clean after that product that doesn't contain the allergen. Then you're going to collect samples of swabs or rinse waters. But most importantly, as I said on the panel, always test the next product that's made that does not contain the allergen. That's what the consumer is exposed to. And that's a really key part when you're doing cleaning validation and making those choices. How do you choose the right lab? Well, this is difficult, to be honest. Your base entry level is that they're going to have some kind of independent accreditation, which in lab testing word is to ISO 17025. That will tell you they have a quality system in place, won't necessarily tell you that they're experts at it. But just because the laboratory is accredited, make sure that the test you're asking them to do is under that scope of accreditation. But what you really want to know is actually, do they know what they're doing? Are they experts in it? And how do you assess that? Well, can they help advise you on how many samples, where from? Can they advise you on which is the right test? Because actually that one might not be the right one that you thought. Can they talk you through all of that? And most importantly, you're going to get a result back that you need to think about that's going to provoke some kind of action. Can they advise you on what that result really means? When we think about sampling, a positive control is really important to do because you need to ensure that the test can recover a high level of the expected amount. And you can do that on a theoretical basis, send it to the lab and see whether or not they can actually get the right answer. You're going to take swab samples then, hopefully from all different types of surfaces, and also always the difficult to clean and the hard to reach areas, because if they have been cleaned to a non-detectable level, then everything else should be clean. Ensure, as I said, those results are reported as a microgram per swab, not a part per million. And then you're going to test the next made product. But you need to know that the lab had that contaminant still been there, that they would have been able to detect it. And they'll do that through a spike recovery, spike addition type of test. And ideally, you should repeat that process 3 times to show that it is indeed repeatable. I talked recently here about a case we worked with a customer, and the reason I'm telling you this is there were some pitfalls in what happened. So a customer had been testing a product for egg using a UCAS accredited lab, and both ELISA testing and on-site rapid tests they'd been using, and never had a positive result from either. It turned out that the contaminant in the product was actually cooked egg, not raw egg. And the validation that the laboratory had done did not reveal that the rapid test would not detect cooked egg. And the ELISA kit they'd selected was under-reporting by 5,000-fold. There was nearly a dispute over this because one lab's finding it, one lab isn't. So they sent the actual product that did contain the egg to 2 more UCAS labs using 2 extra different ELISA kits. one underreported by 3,000-fold, one detected 93% of the expected level. And the message here is that had a positive control been done at the beginning of the exercise and the right validation had been done by the laboratory, it would have been avoided and the right test and the right lab would have been selected at the beginning. So acceptable cleaning validation, well, there are no written rules for this, but typically you'd expect to clean to a non-detectable level and have no allergen detected in the next made product. You want to use an accredited and expert lab and the best available test, but not always with the lowest limit of quantification. As I said, the validation really should be done 3 times when it's initially done with different shifts or different teams to show effectiveness, and then repeated if anything changes or possibly periodically. Everything has to be documented. Back to our learned friend, our QC. You have to make sure all of it's documented with the rationale recorded for all of the choices that you've made. For verification, your cleaning needs to be done to an absolutely standard procedure. And when you're inspecting it, it needs to be to a no residue clean, independently checked by someone who hasn't done the cleaning themselves and signed off. And ideally, photos and key inspection points can really help with this to show acceptable versus not acceptable. You will do a risk assessment to decide if you want to do some periodic verification testing, and it might be that you do quite a bit initially and then reduce it over time as you build up the evidence. But those rapid on-site tests have to be validated. You cannot just buy them in the box and use them. You have to demonstrate that they would detect your contaminant on your surface, and they're only suitable for clean samples, not for ingredients or finished products. Okay, let's look at catering, because the guidance was also covering the catering sector. And it's a really challenging area, I think. It covered 3 areas. The catering environment itself, which I think is often a more challenging area than a manufacturing environment. It covered ingredients particularly that you really must buy free from ingredients. And it covered an area on staff training and communication we've heard time and time again today. Validation in catering, well, you're not going to do that chemical validation at all, really. You're going to certainly buy free from, because does not contain does not equal free from when you're buying ingredients. How are you going to store those free from ingredients? You know, when you think about a busy catering environment, they don't have the same controls as a warehouse is going to have in a factory. So they need to keep things stored, labelled, definitely, sealed, yes, away from possibly the things that may contain the allergen they're trying to make free from on. How are you going to prepare the dishes? Are you going to have a particular area where you're going to be able to prepare the free from, or can you pick a particular time where you can prepare maybe base recipes for your free from provision? If your labelling says, you know, please ask a member of staff, well, you have to make sure that that member of staff is available at all times. I was at a food safety conference last week on Thursday in London, and it took me 6 people to find out a simple, I'm personally allergic to hazelnut, just to find a simple question about a biscuit. You know, it's really not good enough. If you say ask someone, you've got to be able to have them available. Communication is probably the most critical area, and there are so many opportunities where it can break down. And in terms of your training, you know, FIR is very clear about what catering has to provide. It doesn't have to be written down, but if it's verbal, it has to be accurate, consistent, and verifiable. Those are the 3 watch-outs in terms of catering and training. But it's really all about the people communication, and so many opportunities really for that to go wrong, whether it's between the consumer coming in and talking to the first front of house person, or front of house communicating back to the chef in the kitchen, within the kitchen, or it coming back to the consumer. So when you're thinking about training in the catering environment, there are so many opportunities that you absolutely have to get it right. I have a few closing thoughts. We're not getting any better at this, that's for sure. When you look at the European Rapid Alert System for Food and Feed over the last 5 years, we're seeing a steady increase on the number of alerts for allergens. 2015 happened to be a particularly bumper year because of the spice issues that we saw, and I think that raised them really quite a lot. But I did a little piece of work where I looked at 2016 versus 2015 for the same 7-month period. And the number of alerts in the UK from the FSA are up this year on the same period of time last year. Chun-Han's nodding at me, that's good. And the number of products impacted is also up. And the reason they're not the same is you might have more than one product that's actually recalled with one alert. I want to finish up with just some stories of a few of the recalls in 2016, and they're not all about free from, but I just thought they were quite interesting. We've been talking a lot about may contain, so it fits in well. So the top one, the Coffee No. 1 chain, they sold a hazelnut and praline brownie here. It was labelled as vegetarian, low-fat, gluten-free, wheat-free, dairy-free. Oh, sorry. It contained milk. That's fairly clear, although Hazel in the audience here, I love her phrase when she says dairy. I think you'll find that's the building in which cows are milked. So, which I always love. You know, obviously they're referring, well, presumably they're referring to milk. Who knows, they might be referring to milk and egg. That was recalled, very clear decision, actively labelled, it doesn't contain, it did contain, straight decision. The next story is the picture on the left here. So Boulder Brands, who own the brand UD, they make quite an extensive range of gluten-free products, both under the UD brand, and also they sell through retailers. The issue was not, in this case, about gluten being in gluten-free. It was about sesame being in a seed mix. The reason I bring this up, again, for me, when I spend time in factories making free from, that they'll spend 90% of their focus on the thing that they're making the free from claim about. And it is oh so very easy to forget about the other allergens that they may have on site that they are trying to manage. And I think that's just, it was a very expensive exercise because it impacted some retailers as well. So nothing to do with their free from claim. The next one is Sainsbury's products. So they were selling almonds and flaked almonds, and some packets contained Brazil nuts, which clearly is an undeclared allergen. They had a not suitable for nut allergy sufferers, but that was deemed not a sufficient warning. And that, for me, comes right back to the story this morning when we're talking about action levels, and Chun-Han made a very clear message about action levels are only about homogeneous contamination. If you deliver a whole Brazil nut to somebody, that isn't a little bit, that will always be above an action level. So that precautionary labelling thing is just an important thing to mention. The one on the right here is, I want to say IKEA, but it's not, it's IKEA. So I was corrected. They had several products that were recalled because they contained either milk and or hazelnut and or almond as undeclared allergens. And the phrase of why they had to recall them was they contained them frequently and not only occasionally. So the may contain that they had was deemed an insufficient declaration. And again, I think that's an interesting message for us all, that actually this may contain levels and action levels. It's not always perhaps as straightforward as one might think. Thank you.